I want to introduce my father to come and talk today about sleep problems. He's written some books in the field, Healthy Sleep Habits, Happy Child. He's been researching sleep for his entire career, how children sleep, and he's going to talk about some common sleep problems. He is also having a new book coming out in June called Healthy Sleep Habits, Happy Twin. He's one of the pioneers in the field, and he's done a lot of research, so feel free to ask him any questions and stuff.
And his real claim to fame is he and I were residents together. So that's his real.
And he and Dr. Schreiner go way back. So, here he is. And my mom is here as well.
Do any of you have children? Excellent. Okay. So, you get a little handout? Anybody need a handout? Handout?
They're in the back. They'll pass it on.
Yeah.
They'll pass the screen.
All right. I'm going to speak for a very short period of time and then have time for questions. And I know that Dan has explained to me, you've had some presentations on pediatric sleep issues, but in most pediatric training programs in the United States, 4 years ago, the research showed that pediatric residents have an average of 2 hours during 3 years. So in general, pediatric residents aren't being taught much about sleep in children, but of course it's a third of the child's life, and we need to understand how sleep is important for the child. And I will only read a little bit of this, but I'll refer to a few other things. If you think of similarities between food and sleep, you can think about food and the quality of food. And of course, food is a biologic need. Food is energy for the body. Poor quality food or junk food damages the body by causing all the medical problems you can imagine. A little junk food is okay, a lot of junk food is not. Sleep can also be viewed as sleep quality. Sleep is a biologic need. Sleep is energy for the brain. Poor quality sleep harms the brain. And you want to think of poor quality sleep as junk sleep. And junk sleep is just as bad for our children as junk food is. And junk sleep causes these bullet points on the handout, which I won't read, you can look at. But all those bullet points are data-based. It's not my opinion, but there's solid evidence that junk sleep harms children. It also causes maternal depression. Mothers who had no predisposing genetic, family history, or reason to be depressed do become depressed when their children don't sleep well. Probably the mechanism is their own sleep deprivation and anxiety. And just as you would not ever starve your child of food, the message to parents is to try to not sleep starve your child. Parents, of course, read labels on jars of food, packages of food, and the problem is that sleep doesn't come with labels. There's no way to measure in a child, is your child sleep deprived or sleep deficient. But quality sleep means consolidated sleep occurring in phase with circadian rhythms. So we know what quality sleep means, and we know it changes with time, but sleep is a power source that keeps your mind alert and calm, as your leader was, as I was, as you all are, sleep deprived. That's part of residency. You can't function optimally well when you're sleep deprived. And that's true for children. Every night, every nap, sleep recharges the brain's battery. The child's sleeping brain is active and purposeful. Parents don't understand this, and they think sleep is the uninteresting byproduct of having a busy day, so they can do what they want to do, but they don't appreciate how valuable sleep is for the child. So you need ways to communicate to parents about how useful sleep is to the child. Sleeping well increases brain power, just as weightlifting strengthens muscles. Sleeping well makes children more physically relaxed and mentally alert. The little section on updates I'm not going to really talk about, except I'll mention 2 items, which is the involvement of fathers. It says paternal involvement in infant care may contribute significantly to the development of infant sleep. When fathers get involved, children will sleep better. So when you're talking to parents about the child's sleep issues, you have to include the father. If you just talk about the mother and what she's doing vis-a-vis sleep, and if there's a sleep problem, you'll probably not succeed unless you can get the father involved. And the reason is that mothers tend to be overwhelmed, sleep deprived, especially for the young children. And if the father doesn't allow the child to get the sleep when he or she needs to sleep, then you give all the advice you want, nothing will happen. So we need a team approach, because when the child doesn't sleep well, you have a overtired family. And so you're talking about the benefit to the child, the benefit to the family, the benefit of the marriage, when you're talking about sleeping problems. Another recent article talked about sleep problems in childhood predicting neuropsychological function in adolescence. 10-year-olds who had sleeping problems by 13 were impaired when tested by child psychologists. The impairment, though, has to do with executive functions. Executive functions are organization planning, multitasking, and understanding consequences of your actions. Prefrontal lobe develops this capability starting around age 10. Children who were having sleep problems at 10, by 13 were impaired. But the impairments have to be sort of delicately discerned. For example, the 13-year-olds would be tested as follows. With a stopwatch, in 1 minute, give me all the words that you can think of that begin with the letter F. Now, they've never been tested on this before. This is a new, this abstract thinking, recall of words. Kids who had sleep problems when they were younger were way behind in their ability to do this compared to kids who were sleeping well at 10. Another test would be something like this. You have a paper with dots on it, 1, 2, 3, 4, 5, many dots. Time, connect the dots. Second test, 1A, 2B, 3C, 4D. Time, connect the dots. Children who had sleep problems at age 10, at age 13, for the second test, which is a more effortful test, couldn't do it as well as kids who had no sleep problems. So if you do routine recall, memory tests, math tests, reading tests, cognitive tests, they do fine. But if you do more sophisticated testing, you see that kids are impaired if they don't get the sleep that they need. The number one thing to remember is that sleeping helps the brain develop. Sleep is energy for the brain. And so you never want to forget when you're talking to the parents that sleep is not a luxury, but it's a biologic need. And that sleep deficiency harms the brain just as vitamin D deficiency or iron deficiency causes disease. We all are brought up with a medical model, and there's no reason not to think about sleep in this medical model, to educate parents about the importance of sleep for their children, and to try to motivate them to get healthy sleep for their children. If you think about sleep in this healthy way, then it fits with everything else we talk about, which is healthy food, healthy diet, have healthy habits for our children. So I'm going to stop here and ask if there are any questions before I go on with any more prepared remarks. Any questions about sleeping in children?
How many people here have or seen or know about Dr. Weissbluth's books? There are a lot of students who wouldn't know that. There's a fair number. Paul and Narissa, do we teach residents anything about sleep problems and these things? We do. So they really all are experts and know all this stuff. Okay.
There should be some questions before I go on. I'll just wait until somebody raises
why
their
I
hand.
asked that question. Yeah.
Yes, sir.
How did Dan sleep as a kid?
Dan's mother, Linda, can answer that question better than I can.